Welcome, everyone, to the Socket podcast. Today, I have my friend Leena Bird with us. Leena is a pelvic floor physical therapist. Her company is called Leena Bird Physical Therapy. And Leena and I met a couple of years back. I think we've kind of crossed paths here and there as a pediatric chiropractor and what you do. I think some of our colleagues overlap and through the chamber and things like that. So, Leena, welcome to the podcast.
Hi, Cathy. Thanks so much for having me. It is like really an honor to be here. I feel like I think this is like our second date because it was like you were saying, I feel like we've known each other, just very distantly for a long time. But some of my friends that are your friends, were just like, you should just ask Cathy out on a date. So I did. We went out to lunch and it was awesome. I'm like, why did I wait this long? So,
I think we were there for like 2 hours. I mean, it was like we were just kept, yap. We could have talked, for the whole day.
Totally. So thanks. It's wonderful to be here.
Oh, great. How's your week going so far?
It's great. I mean, I was out for a walk this morning. The snow is melting.
Nice.
I mean, it's like, kind of the seasons are starting to change maybe for a day.
I know. It's funny. I was at an event last night and we were joking that at this point, when it's 32 degrees out and the wind's not too bad, we're like, kind of balmy out. Pretty nice. Don't even need a jacket,
Exactly. It's hard to convince the kids to actually take a coat with them today.
Yeah. I remember a number of years ago, one of our friends got married right after Christmas in Florida, in Sarasota. And so a group of us from the chamber went down there and stayed at the hotel. And it was about 65 and sunny. And we are out in bathing suits swimming. And then people literally had full-blown parkas and hats and gloves. And I'm
That's
like,
awesome.
Man, we've got different temperature ranges here. So anyway.
Yeah, for sure.
So why don't you give us a little bit about your background, who you are, and why you decided that you wanted to work on the pelvic floor for your career?
Okay. Well, I like to start with the best things in my life. So that is being a mom. So I have 3 little boys. They're not so little anymore, that are 6, 9, and 11. So they gave me my favorite title of mama. I have a husband named John, who I've been married to for about 13 years now. So he is just that super dad that I love. He's my rock, and I wouldn't be here doing what I'm doing if it wasn't for him. So we live in Naperville, and we've been here really ever since I was 9 months pregnant with my first son. So we haven't gone anywhere, and we don't plan on going anywhere. We love it here. So
That's awesome.
Yeah, it is great. So I've been a PT for coming up on 20 years, but the last 12 years of my career, I have specialized in the women's health space and pelvic health space. So, again, it's a passion of mine that really started when I started my own motherhood journey. So with my own pregnancies and postpartum recoveries, it was something that I definitely saw the value in for myself, and obviously kept seeing that in the dedicated women's health space that I was working with. So it's been awesome. I've had wonderful mentors and colleagues over the years, and it's just kind of kept fueling my desire to want to learn and serve basically an underserved population. So
it doesn't seem like it's much of a coincidence that you have an 11-year-old and then you've been in the pelvic floor women's space for 12 years. That seems to match up a little bit if I'm doing my timeline correctly.
Totally. You've got it exactly right. And it was one of those things, I was pregnant at the same time a lot of my girlfriends were, and a lot of those things that I think we talk about and either brush off or laugh about. I was like, there's no reason that we should be walking around in pain when we're, growing humans inside of us, or that we, are talking about, leaking or, not wanting to have sex or things like that. All the leaking, right?
All the leaking.
There's got to be something. There's got to be something missing. So that was just my, my reason for wanting to learn more and really work with women and give them that independence and confidence back, so that we can, be the mothers and the women that we're designed to be. So
yeah. Well, I know when we met for lunch, we talked about a serious topic that you have now had to navigate a breast cancer journey. Can you share just a little bit more about that as well?
Sure, sure. Thank you for bringing that up. It's definitely another area that am very open about talking about, and I think it's really important. So in 2018, I was diagnosed with stage 1 breast cancer, so early stage breast cancer that was found actually on a mammogram. I had a midwife who was a 2-time breast cancer survivor, and she was just really proactive about wanting to get her ladies to have baseline mammograms before they were 40. So I was 39,
Mhm.
had it, and it literally saved my life because the cancer that was found was really extensive. And had I waited till I was 40, my story might be a little different today. So
Yeah.
that being said, yeah, I chose to have a double mastectomy. I ended up needing chemo and had reconstruction surgery, and then had other therapies for a year. So it was a long journey, but I had a dream team around me. You can't go through life alone, right? So this is where like those people really stepped up. My
Yeah.
family, friends, neighbors, all of my own therapists and doctors and medical providers. So it I'm happy to say I'm here and I'm doing great, and just happy to give back in this capacity. So
Well, I'm grateful that you found it early and that you were able to
yeah.
go through that and you got all that support. I mean, it is amazing when, women are known for being givers, right? And I'm
Mhm.
sure, and especially moms, right? We give
Yep.
and we give and we take care of and we take care of and we take care of. And when we need take some taking care of and some comfort ourselves, sometimes it's hard to ask for it. So learning how to ask for it, but also you see those people that immediately are just right there. And
Right.
it's wonderful to feel that love coming back, and you do it for them, but somehow accepting it for yourself can sometimes be a little challenging.
For sure. For sure. Definitely a little humbling, but
Oh,
again, that's everything like you say in all of your interviews, things come around full circle. So
they do.
yeah.
So when we were talking about what we were going to chat about, obviously we're going to dive into the pelvic floor. And, not everyone's comfortable talking about, where things come out and what happens down there, right? I mean, I know for me, as soon as I gave birth, I was like throwing up, having diarrhea, having contractions on the toilet. And I'm just like, you know what, at this point, whatever you need to see, whatever you need to do, just help me get a baby out of my body. So
For sure.
I feel like I became very, very comfortable in almost any setting, but this is a setting that many people are not comfortable with. So anyway, you listen to the podcast, which I really appreciate. And you brought up the fact that I go through the toss, recycle, and elevate. You're like, what about doing that for the pelvic floor? And I thought that would be awesome. So
Yay.
so this will be different because than anything else we've done, because normally the toss, recycle, and elevate is personal to our own lives as
Sure.
a human being. This is actually about part of our anatomy and some of the things that people should know about it, don't know about it, have misconceptions about, and how we can make things as good as humanly possible as we go through this journey of being a woman. So let's start off with tossing. What do we
Okay.
need to toss when it comes to our pelvic floor?
Yeah, there's a lot of things that we can toss, right? But again, like you said, we're going to focus on like those myths or those misconceptions about pelvic health and pelvic floor related issues. So, just I'm going to back up just a second. Like, I think just to kind of set the groundwork, like when we're talking about pelvic health, this is everything, like all the things that are uncomfortable to talk about, right? Pee, poop, and sex. I'm just going to put it out there. And that's
Yep.
just to kind of
Yep.
set the stage for things that we're going to be talking about, right? So again, it's those openings that are very important to our functions as humans. So one of the things that really irks me that we just toss around out there is that leaking urine, leaking gas, leaking out the other end is normal. It's very common for women to have some of those concerns and struggles, but it doesn't have to be your truth to live with. So, the fact that we discount things and say, oh, it's just a little bit, or it's just when I sneeze, or just when I, go for a long run, like it shouldn't happen, period. Like
Yeah.
it's not acceptable.
Well, and I don't know if I'm sure I did shared my trampoline story with you. my boys were young. They were probably 3 and 4. And after I had them, I had 2 vaginal births. I certainly have dealt with some incontinence. And, it was just a little bit. I never really thought all that much about it. And we were at a New Year's Eve party, and I was dating someone new. So it was at his friend's house that we went to, and I think we were going to stay the night. So I had my pajamas and I had my one outfit. That's all I had. And so the kids, they had a trampoline out back, and I was a gymnast and a diver. And, I can throw a mean backflip on a trampoline to this day. So the kids are out there and they're like, come watch us. And I was like, I can do a backflip. They're like, no, you can't. I'm like, yeah, I can actually. And so I get out there and I start bouncing, and I'm like, bounce, bounce. And I do that last deep bounce. And I swear to God, about a cup of urine comes out. And I do the backflip, and now I'm sitting in jeans.
Oh no.
I went inside and I was like, oh my God, I just peed my pants like really bad. And everyone in the household was like 14 sizes smaller than I was. So there was no borrow my sweatpants or anything. So like I found a hair dryer. I'm like, oh, it was so embarrassing. So yes. So anyway, that's my personal story.
Well, and I have stories like that too. My personal stories where I didn't have much urine leakage, but I would let out little toots in not the best, situations. So, that's not cool when I'm treating patients or I'm in a yoga class or, trying to do downward dog. I'm like, okay. So again, I knew what I needed to do to help myself. But I think for a lot of women, like either you have that one episode where you have that leakage and you're like, never again am I going to jump on a trampoline. And then your kids are left there like, but mom, come and play with us, or come play chase with us. And you're like, you make up excuses, right? And that's, that's part of the fun of like being out and about with your kiddos and being able to do things and not feeling like you're limited because of something that really is treatable and, and can be prevented too.
So let's dive into that a little bit more. So,
okay.
I come to you, I share, what my issue with that, or someone comes to you and is farting all over the place here and there, yoga, everywhere they bend over, right? What does a visit or a treatment look like? I don't want to get into a really long conversation, but
no.
In my mind, of course, there's external, there's internal work, there's, and I think that probably is a stopping point. I will say it's been a stopping point for me, as open as I am with my body. Like, what are you going to do to me? I guess is the question.
I love it. I'm so glad you asked, because I think, again, you're not the only one that's like, I'm good, thanks.
Yeah.
I got to the doctor. They said everything's fine.
Right. I'll just wear a pad every day for the rest of my life. It'll be fine.
Yeah, no. We don't need to give more money to that industry. So that being said, again, I need to start by telling you, like, pelvic health physical therapy isn't just about looking like this at your pelvic floor muscles. Okay. It's looking at you as a person, a comprehensive evaluation of your entire body. Okay. And so again, I have specialty training in looking at the muscles and evaluating and treating the tiny pelvic floor muscles, that they're part of your core. We think like, oh, I just need to get my core stronger. Well, your pelvic floor is part of that. So looking at how you're breathing and how the muscles in your deep abdominals and your pelvic floor, how they're all connected and how they're working together. So that starts by looking at you from the outside. Okay. I always say, like, we're going to go global and then work local, So again, looking at like simple things, like I just mentioned, how you breathe, what's your alignment like, what's your posture like, sometimes these subtle changes can make a huge difference. For somebody that's doing impact work and they're jumping or they're running, I want to see you do those things. I want to see you squat and lunge. So again, like if you think of traditional physical therapy, we're still doing those things. Okay. But then also we're going to get there. We're going to go there and talk about the things that aren't the most comfortable. Right. So I'm going to go into deep details of like a history of how what's your like bladder history like? Like if you go to the bathroom all the time, are you somebody that holds your pee all day long? Are you getting up at night? Like, do you drink enough water? So we go into like a really deep history, talk about poop, same thing. Like, are you somebody that's like had chronic constipation? Well, if that's the case and you have poop that literally is like hanging out in your pelvic cavity,
Yep.
If
Having a
you're going,
party.
yeah, having a
Poop
party.
party.
We can't fix the pee unless we fix the poop,
Ah,
So again, there's a lot of talking and education and explaining. I'm a very visual person, so I have my pelvic model. We're showing you like, the model of the pelvis. We're talking about like anatomy and how everything is connected. But then when it comes to really evaluating the pelvic floor muscles, again, I like to say it is way less invasive and not as bad as you think than like going to a gynecological exam. So
yeah.
I treat women in their homes. So like, again, it can be as comfy as you want it to be. We can set up on your bed. I have a massage table, but really it's just getting you into a position where I can look at those muscles. I think of it as like orthopedics in a cave. Okay. So so I mean, down there are muscles, there's nerves, there's ligaments, again, connective tissue. So we're looking at all of that, but
Okay.
I'm trained to be able to assess those muscles intravaginally and intrarectally when it
Okay.
is needed. Okay. And
Yep.
so that's not everybody. Okay. And it's when you decide that you're comfortable with it. And when you decide that this is okay, I see the value in this, and this is going to help me to reach my end goal.
Okay.
So,
Okay.
okay. So it's not like hop on the table. Here we go.
You're right. Just spread them open. Let's go for it.
Yep. Yep. Not at all. Not at all. Again, usually the response that I get from people is like, you took something that I was so scared about or so nervous about and made it, like a non-issue. So
Yeah. Well, and that's the comfort of the provider and that doctor
yeah,
or physical therapist patient relationship, which is
yeah,
so
for sure.
important, right? I know one of the
Hmm.
things you mentioned in some of the things we talked about was, not every provider is going to be the perfect fit for you, and that you could go see. I find this in chiropractic as well. I mean, Jason, my husband, the first visit he ever had, the first and only visit he had to a chiropractor before he met me online, I think he almost was like, ooh, a chiropractor? I don't know about that, because he had a terrible experience with someone that was just going to, rope him into 48 visits and just sound like a salesman. And so you really do have to be your own patient advocate. I've talked about this before, and I'm so
Sure.
passionate about it because people say, oh, well, I'm going to try acupuncture. I'm going to try chiropractic. I'm going to try pelvic floor therapy. And they go somewhere and it's not the right fit. And then they think, well, that didn't work. When in
Hmm.
fact, it was the relationship between the provider and the patient that just wasn't the right fit.
Exactly, exactly. And I'm the first one to say, like, again, not everybody is going to be your soulmate level provider, right? And
Yeah.
just like, I'll be honest with somebody if like I don't feel like they're the right fit for me, and so you have that. It's your body, it's your choice, you get to make those decisions. So
Yeah.
I'm definitely one, yeah, like you said, I know you're very open with like, okay, if I'm not the person, I have lots of colleagues in the area that I can refer you to.
Absolutely.
And same thing. I think I have some amazing colleagues in the area and nationally that I know now too. So I have no problem with helping women connect with somebody that's the right fit for them.
Yeah, absolutely. Well, you even said you would share with me like a directory that I could
Yeah.
post in the show notes and things like that.
Yep.
So we'll have that with the notes of the show, so that if
Awesome.
people are
Thanks.
looking for someone, they have that resource, which would be great. All right, so I'm going to sing for a little bit. Let's talk about sex, baby. Let's talk about you and me. All right, sex. Isn't that so fun to talk about on a podcast?
Oh, hey, why if there ever is an opportunity to talk about it, you have to, right?
Might as well
So
be on a podcast, right?
yep,
So,
exactly.
so lots of women have changes, especially after giving birth or even as they age, for sex not feeling as good, or sex being painful, or sex being dry. So how do all of those things come into the work that you do?
Yeah. So, right now, the space that I'm in, I see a lot of women that are pregnant or have recently had children. But again, I work with women throughout the lifespan. But, again, it's those, if you think of some injuries that might occur during a vaginal birth, so like
Yeah,
a tear, people have heard of tearing during pregnancy. So, scar tissue that is left untreated can become painful. Okay.
yeah,
It's not like other tissue in our body. So it needs to be addressed. And so, a lot of times, you go to your 6 week or 8 week follow up visit and you get the green light, doctor says, everything's good. You can, go exercise, go have sex. And then you're left there with like, well, what, you just, okay, the stitch is healed, but what am I supposed to do now?
Yeah.
So, and then that first time that, without any guidance, you return to being intimate with your partner and you're like, okay, that it's not happening again.
Yeah.
No. So again, I think scar tissue is a huge reason as to why, sex can be uncomfortable, but it's not just for women that have had vaginal births. C-sections, cesarean deliveries also can impact your pleasure with intimacy. So, because again, that scar tissue, you're in your deep abdominal muscles,
Yeah,
right into your pelvic floor muscles. So again,
yeah,
it's actually,
it's all
I think
connected.
it's all connected. It's all connected. So again, but knowing the right, again, those simple things: how to breathe, how to learn some basic scar mobilizations, how to re-educate these muscles so they can do what they're supposed to do. They can relax and then they can contract. Okay. And that they're not just in a protective state all day long. So,
Yeah.
Those are some things that, again, nobody talks to you about when you go to the doctor. And so this is, again, why there are people like myself in the world that can help you.
Right. Right. Well, and I think one more thing we're going to talk about with tossing before we head on to the next category of recycling is it's not just about doing Kegels, correct? That seems to be like, oh, well, I'll just do some Kegels for this and that should be, but sometimes sometimes you need to relax things, not tighten things. Is that correct?
Yep, for sure. And that's why, again, it's super important to find out what your body specifically is doing. Because again, if you have a pain condition and you start doing Kegels, you're tightening a muscle you're working on contracting a muscle that's already tight. You need to do the opposite and give it some love and give it some grace and teach it how to let go. And so, I think that is very important to realize that Kegels are not for everybody.
Yeah.
Okay.
Well, and I think to add a chiropractic component to it, because we certainly see people postpartum, is the pelvis. You think about a baby has to grow inside a woman's body and everything expands. And then we give birth and we birth this baby with this head this big, through an opening that's not, doesn't seem like that should be able to fit, but somehow magically does. And then their body is healing and kind of coming back together, their pelvic area, while they are not sleeping well. They're holding a new baby. They're doing awkward movements. That's a lot to expect our bodies to do. So with postnatal chiropractic, we help balance out the pelvis, which also helps balance out the nerves that go to all of these areas, right? The nerves that control the bladder and the uterus and sexual pleasure and pain and things like that. And then the cranial work we do is one of the most surprising things. It's an upper palate adjustment we do for people, and affects all the cranial nerves, and it affects the vagus nerve, which is kind of our GI. It controls so much of our body. It's like our lifeline nerve. And so many times we'll start doing this with someone, either regular chiropractic or with the cranial adjustment, and they'll come back, they're like, can I tell you something gross? And I'm like, you're pooping better, right? They're like, how'd you know? I'm like, because you're not the first person to say this. Because then we can actually, as long as the nervous system is working as well as possible, the motility of the colon and helping push the poop out. So it's really interesting because, some of it's dietary, some of it's dehydration, some of it's, pelvic positioning, but some of it's just nerve control as well. So it all works together.
Well, yeah. And I think, again, that's why I love just the blend of both of our specialties, right? Because again, you're looking at it from that perspective. And then I'm, again, doing more like myofascial work and stuff to kind of help to get, when we're talking about poop, get things to move where they're supposed to go. But again, teaching you how to breathe, again, tapping into that vagus nerve, right? Using your diaphragm and promoting that relaxation throughout our body, I think is something that is really challenging as a new mom, when like you're saying, when you're sleep deprived and just trying to figure out how to keep a little human alive. So, yeah. So again, I think that, it's a lot. So I think, again, just having all of these, specialties or these disciplines on your team is really important in your healing.
Absolutely. Absolutely. All right. Well, let's move on to recycle. So recycle within the socket world means, what do you have to change? What do you have to look at and be like, you know what, I need to tweak this a little bit. I need to switch this up. I need to recycle it. So what are the couple of things for your pelvic floor that we need to recycle?
I think just again, looking at just your overall health through a different lens, right? And so wherever you are on this journey through motherhood, like we're not static beings. So what your body needed during your pregnancy is different from what it needs in that fourth trimester after having a baby. And that's
Sure.
different in that full first year postpartum. And it's different when your kids are 5 or 10 or 20, So again, just realizing that we're not programmed to be able to do the same things our entire life. And that's okay, and learning what your body really needs from all of those things you talked about, like a nutrition standpoint, sleep hygiene, what do you need to do for your own stress management? And then figure out like, physically, like what's your body need in this moment to stay active and strong and give you that longevity that truly, overall like health and wellness is really about.
Absolutely. No, I couldn't agree more. Couldn't agree more. I know for 2021, we rolled out the 12 elements of health. It was
Yes.
kind of my attempt to be like, what are the 12 things we can talk about, one thing per month, that can help promote the healthiest expression of our own human body. And all of the things that you listed in some of the notes that we kind of sent back and forth, with sleep, with stress. I even put this month right now is ergonomics of life.
Yeah.
Right. Of how do we need to change our ergonomics when we're sitting at a desk, when we're sleeping, all of the times that we're in positions for a little bit longer than our bodies are really supposed to be in. So
Correct.
those things that, talking about all of those things are so important. And I feel as if sometimes we get a little too focused on just, all right, we're sick, what medication do we need? And there's a time and place for all of that. But how can we take charge of our health and be our own patient advocate and do the things that we can do for ourselves that we have complete control over for our own bodies? And that really excites me when people want to dive into that and make some changes in their overall kind of lifestyle that they live for that longevity, for that best expression, for that,
Yes.
Hey, I want to be an active grandparent. I want to be able to get down on the floor and get back up. Right. So I think that's just such an important conversation.
For sure. And I think again, like we both speak the same language when we're talking about prevention and early intervention, right? Because the things that I'm working with and helping women with are conditions that are treatable and they can be prevented and we don't have to live with them.
Yeah. Yep.
Okay.
Is there anything else that falls under that, recycle category?
Yeah. Well, and I think just going back to when you were mentioning, so what exactly is pelvic floor PT?
What are you going to do to me?
Yeah, but I like to say, like, think of a pelvic floor physical therapist as like that girlfriend that you can talk about anything with, right? Like, pee, poop, sex, like all the things that are like uncomfortable or just are really vulnerable to share and realize that, like, again, we can help with, again, providing some of that support, or if not, directing you to the person that's going to help with that, whether it's somebody, whether you're a new mom and you need lactation support, or chiropractic support, or if you need mental health support, again, this is where, like, I think both of our fields are very connected with the community and realizing that, again, like, it's okay to ask for help.
Yeah.
And it's okay to have multiple people on your team that are going to help you to achieve that end goal.
Yeah. No, it does. It takes a little bit of a village, right?
Yep,
and
sure.
I'm sure one of the misconceptions is, oh my goodness, no one else is going through this, right? It's
Right.
Man, so many women have these issues. And some are mild and some are severe. And I'm sure that you have heard it all. And that you're not embarrassed by it. You're very well versed in it. And, I know at my office, we see a lot of kids and a lot of them have constipation. And I'm like, hey, we're going to talk about your poop. And I just try to make it fun. I'm like, I love talking about poop. Like, so how is your poop? Like, is it hurt? Is it big? Is it, like it should be like soft serve ice cream. And I, try to make it fun for the kiddos. But for women, I think, one of the things I think of in that recycle category is, it's okay to share what you're going through.
Yeah.
And when they're with a trusted professional, like they've heard everything you're going to say, or at least probably have heard everything that you're going to say. And it's a safe space to be able to share that information.
For sure, for sure. The last thing that I want is for women to feel like they have to suffer in silence.
Yeah.
And I think a lot of us do, and because it's either we're ignoring it or we're putting everybody else's needs first.
Yeah.
And so
For
again,
sure.
yeah. So just
For
giving
sure.
yourself, give yourself that permission to take care of you.
I think as I was counting up how many podcasts I've done, because I'm getting closer to my 100th episode, the first podcast that was launched, my first sentence is it time that you put yourself a little higher on your priority list? That was the first line of the Socket podcast. And that theme runs throughout it of you deserve to put yourself on the list. I understand that at some phases of life, you're not top, right? If you have a newborn baby, the needs of this newborn baby have to go above what your personal needs are in some ways. But women they're really good at putting themselves last, or maybe just scratching themselves off for a period of time. So this falls into that self-care and making sure that you do add yourself to the things that you're taking care of.
Yeah, no, for sure. I think that this kind of bodes well to moving into Elevate, because I think that, if you don't mind me just kind of going.
No, you take the lead.
I think Elevate, when it comes to what everything that we've been talking about, is just elevating your own knowledge about your own body, how it should function, what you can do to keep it working the way that it should. And I think that that's why, like, I love working with women, like, during pregnancy, because I feel like it's a really good opportunity to educate them on, like, again, what is quote unquote, like, normal. Again, everybody's journey is going to be different, but these are the things to look out for. If you have pain, if you have any, like, pressure in your pelvic area, if you are leaking, like, those are things that are no. So again, knowing how things are supposed to work, so then you can get that that intervention right away.
Yep.
Okay. And so again, and it doesn't have to be this huge time commitment, or weeks and weeks and months of, like, multiple sessions a week for therapy. Again, I think I like to keep things super simple in my approach with, again, what number of visits are, like, the best for you at this stage in your life. And let's keep your homework super simple too, because you don't have time for an hour, an hour of PT exercises to be doing every day.
I think that's so important too. I mean, I think sometimes things become a little too overcomplicated, and then people forget what you said, or, like, overwhelmed by it, or, like, I don't have 45 minutes. I have 5 minutes. What can I do in 5 minutes? Right. When I have a moment, especially postpartum. But I think that the easier, the better for most people.
Yes, for sure. That's why I said, if all else fails, just breathe. Once you learn how to breathe, you can do that anywhere. It's free. It's with you at all times. Just, again, if you have 5 minutes, just breathe. That's, like, my go-to.
Well, and to talk about breath for a second, it's amazing to me how few people really do a full breath, right? And especially as a woman, to breathe correctly, your stomach has to go out, right? You have to breathe all the way down and into your abdomen. And that is something that women don't do. They want to suck their stomach in, so I find a lot of people in our practice, they chest breathe, and they don't actually get the breath down into the pelvic cavity. I guess the pelvic cavity, I guess, is that right? But and then you're not engaging those muscles that are supposed to be engaged, like, every few seconds of your life. And then they're just left dormant, really.
No, for sure. I can't tell you how people are, like, blown away at the fact that, like, our first session, like, really focuses on breath work, but just making sure that you can feel that connection, like, down in your diaphragm, like, deep in your, feel that expansion through your rib cage. And I don't leave until I know that you've gotten it, So it's not, we're going to try lots of different positions. We'll get you on your hands and knees, on your side, on child's pose, like sitting, standing, all the positions, because we do in every position, right? And yeah, I mean, I think it's super important. And once you get that, it's like light bulb moment. Then you can incorporate your breath into every aspect of your life, and whether it's just those movements, like picking your kid up from the floor,
Yeah.
or when it's when you're at the gym, or working out down in your basement and doing lunges or squats, like you have to breathe correctly.
Yeah, for sure. Well,
Okay.
and another thing I know that you're helping women is empowering them and helping them with their confidence. And, I've talked a lot about body confidence and how we feel as women about our body. And especially as our body changes and we're not, 21 and haven't given birth to 2 or 3 kids. It's challenging to just be okay with our bodies, to just accept our bodies and love our bodies and have that confidence that, hey, some people are going to be pregnant 4 times and their bodies are going to just snap right back into shape and they're going to have a flat stomach for the rest of their lives. Some people are never going to have that happen no matter what they do. So I'm just super passionate about helping women understand that everyone's body's different. Some things you can't control of how your genetics are, and how,
Exactly.
there's parts of it you can control, but there's definitely parts you can't. So helping women find that acceptance and confidence, I think, is something that we both share.
Yes, no, for sure. I always say, like, again, inner strength and inner confidence is what I'm looking for. Again, inner strength does not equate outer appearance. So,
Yeah,
yeah.
that's the truth. Well, one of the funniest things as we were talking was you threw this question, right? The toss, recycle, elevate out to your boys, correct?
Oh, yeah.
So what did they have to say about that?
Well, again, just to tell you again of their ages, right? 6, 9, 11, right? So the toss, all 3 of them, because I asked them all individually, it was a ball of some sort, football, baseball, whatever it is. Toss
Yeah.
was, you toss a ball, mom.
Yeah.
Okay, fine. All right. Then for recycle, I said, what does that mean to you? What would you recycle in your life? And they just kind of looked at me like, why are you asking me this? I'm like, what about those cardboard boxes that are in our family room right now? Because we got some new chairs. So there's cardboard cars in my family room right now. And they're like, you can't throw that away. I'm like, okay, how about give me something else? They're like, the milk carton. Great.
All right.
Recycle the milk carton. Okay. And then elevate was my favorite. My 9-year-old, once I kind of told him a little bit about what elevate means, he goes, me. I'm like, what do you mean me? He's like, me. I want to fly. You said to lift somebody up, right? Or lift yourself up. So he's like, me. I want to fly. I'm like,
Oh my
okay,
goodness.
done.
That, what, it's so funny to get kids' perspectives, no matter what ages they are. As my boys get older and older and older, tomorrow I'm moving my oldest to Davenport, Iowa to start his kind of Palmer track. He's been taking classes at COD since he graduated for a year and a half, and he's getting closer and closer to starting the DC program. So tomorrow I'm moving my baby. It's only 2.5 hours away, so it's really not that bad, and he's ready. And we're all, we're just excited for him more than anything. But it is amazing that the conversations you can have, and to kind of peel back a little part of their brain and see what they think about. So I thought that was really great. And one thing I want to ask you before we end the podcast is, where did you get to the place where you decided that you wanted to do in-home visits as opposed to have a clinic or work for someone else? I know that you've mentioned that you go in-home, but how did you decide that was where you were going to land?
Yeah, no, thanks for asking that. When I finished up my breast cancer treatment, I had been out of work for a couple, probably about 2 years at that point. And I was like, I love what I do, if you haven't noticed. So I really wanted to get back, but I wanted to do it in a way that, gave me the flexibility to be able to put myself and my family first. So that being said, I knew that I needed to go venture out on my own and, start on this like entrepreneurship journey.
Yep.
And it was coming up with the in-home idea really was just to serve a need, I think, that wasn't being met. Like again, we're going back to women will make up all the reasons, every every excuse to not have to go, right? So when I was in the clinic, I saw so many women like coming in, frazzled because they had to go, to work right away, or they were coming from work, or they're dragging in all their kids, and they're exhausted before they even start their session.
Yeah.
So I figured, why not? Let me come to you, and then you're already in the comfort of your own home. Baby can be napping. You may, this is obviously a very vulnerable subject to be talking about. You're in your home. It like
Yeah.
right away just eases everybody's mind, and it just makes everything so beautiful and easy and calm. And I love it.
Yeah.
I love it.
More relaxed. They could
More
be in their
relaxed.
jammies. They didn't
Totally.
shower. It's really not that big of a deal.
Yeah. So again, I have minimal equipment that I bring with me. I have a table, and I have my little, I call it my little Mary Poppins cart full of all my little equipment. So, again, and I use what people have in their own homes. And a lot of times those props are humans, little babies, or,
Yeah.
again, simple things. So it's awesome. And I really love that I can give women this convenience.
Yeah.
And
That's
being,
great.
give them that permission to invest in themselves.
That's awesome. Leena, if someone wants to get a hold of you, what's the best place for them to reach you at?
Yep. You can go directly to my website, which is Leena Bird, LeenaBirdpt.com. And then there's a little button that you can click to set up a discovery call. It's not really calls. I like to do video chats because, again, I'm coming to your home. I need you to know that who
Yeah.
I am and make sure that you feel comfortable with me. So yeah, that's the best way. And other than that, yeah, that's the best way. I'm not really a big social media person yet, so I do have a
No worries.
Facebook page, but
Yeah.
my website.
You know what? You gotta figure out, there's so many different ways. I mean, I look at someone's like, I sent you a message, and I'm like, where?
Right.
Because there's so many different places to contact people these days. So the website sounds like a great place to go. Well, thank you so much for coming on and having this awesome conversation. I know it's going to be so valuable to our listeners, and I'm sure people are going to think, all right, maybe this is my time. I invest in myself, put some time into myself, and kind of push past the discomfort or fear or anxiety of what having this done looks like. So thank you so much.
Thank you, Cathy. It was an honor to be here.
Yeah. All right. Well, have a great day.
All right,
And
you too.
for any of you that would like to get a hold of me, you can always reach me by email at Cathy@simplysocket.com. Have a great day.